Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave.
We are always thrilled to have you with us for Wellness Wednesday. And today we're going to talk about a gentleman you've had coming into the clinic there using hyperbarics to help with some autoimmune difficulties.
Yes. So this gentleman comes from about an hour away, and he's a farmer, and he's developed all kinds of fatigue, body aches, pain, brain fog. Things are just not firing right for him over the last 3 to 6 months. So he's had, your traditional evaluation, which is lab work to check for rheumatoid factors and lupus factors, all these things, and they came back saying, yeah, he's got some reactivity going on. He's inflamed, and he is wanting to take a little bit different approach. And so, what do we do to dampen that autoimmunity that's going on with him? And what is it? What is autoimmunity anyway? And why is it that more and more people, it's running rampant, Dave, over the last 10 to 15, 20 years. The cases of autoimmunity in this country and across the world have just, it's gone up like wildfire.
Yeah, and boy, that in itself can unleash a huge discussion as to why this is happening. We talked a little bit about it last week that, the Western diet has not been helpful.
Yes. Yep, that's a big factor. You have to look at a lot of different factors from, the immunization schedule has changed a lot over the years as well, and so that's certainly something that deserves to be looked into and say, okay, is there a factor or a role with that? But there are so many things, environmentally to food related to what we're using for prevention through the conventional system. But autoimmunity is essentially the body is losing self-tolerance. And in a lot of folks, it starts off as silent autoimmunity, and that's where the body starts to attack ourselves, our own selves. Because initially what's happening is if you get an exposure to something like a virus or a bacteria that comes in, your immune system kicks in and it takes it down. But things start to misfire when we get out of balance, when that body gets out of balance. And then the immune system starts to attack itself. And it can attack in different areas. It can attack things like your thyroid gland. It can attack things like your nervous system, your brain tissue, lungs, pretty much throughout the body. It can pick a spot and then it can move. It can travel from one system to the next or one organ to the next. And so a lot of people get stuck in the reactive autoimmune phase. The reactive autoimmune phase is when they start to have symptoms, and especially for folks with the neurologic systems involved, it might be things like, I've got some weakness, I've got some brain fog, I don't have the energy that I used to have. It may be some inflammation, pain, those kinds of things, numbness, tingling, that kind of stuff. And so it doesn't always show up on conventional testing unless you're testing specifically for, some of these antibodies. And so what happens is folks many times get stuck without an actual diagnosis of autoimmune disease, which is the final phase. Autoimmune disease is when you're actually starting to have organ destruction. That's when the conventional system is typically catching this stuff and really starting to use the treatments that you think about. They're called biologics. Enbrel is one, injectables. Sometimes we will use things that are like steroids, things to dampen that autoimmunity from the body attacking itself. But when you dampen a lot of these conventional treatments, when you dampen the immune system from attacking your own immune system or your own body, then you're exposed to further things that come your way. So then these folks that are on these medications, these injectables, the more apt to get infections and get sick and things like that because your immune system is being tamped down by the drug. So with this gentleman, he's already seen some incredible success because he was on prednisone for an extended period of time and just could not get through a day. His primary care doctor weaned him off of the steroid of the prednisone, and we've started to work on some areas to dampen that autoimmunity. And so the things that we've done are, number one, we talked to him about his nutrition. And as we talked about last week with Molly, and we've talked about in the past, many times gluten can be a big factor in the body's trigger to go attack itself. And so that's what happened with our guest Kate, when she came in as well, when she was having the seizures and such. You remove the gluten, and all of a sudden you take the trigger away for this autoimmune reaction. And then other things that we do, and you think about are certain supplemental approaches. So things like curcumin, which it's many times used in Indian dishes, but in a concentrated form, really, really effective. Resveratrol is a polyphenol that's very effective. We want to control our blood sugars. And then we hop into the hyperbaric chamber. That's where he's at. He's coming here twice a week right now, and he's on some of these liquid supplements that I have him on to dampen this immune attack, essentially, which is inflaming him. So I just talked to him last night, and he is very pleased with the progress he's making. I do think that that once your body is kind of on the attack mode, attacking itself, we have to be even more careful with our lifestyle. And so in his case, he's going to have to continue to follow more of this restrictive nutrition, but in the end, it's worth it for him because he's feeling better. He's got more energy. The pain is significantly down, and he's able to get through his days without needing to take a nap, that kind of thing.
So I want to read you a quote here from an MD, Casey Means. Casey and her brother, I believe, recently wrote a book, and sometimes when I quote people like these, I get myself in a little trouble here. But this quote is not from me. It's from Casey Means. And I think a little bit of your clinic is set up a little bit different than the model she talks about here. This is what she says. The stark economic reality is that nearly every institution that touches our health, from medical schools to insurance companies to hospitals to pharmaceuticals, make money on managing diseases, not curing patients.
Yes. So that is certainly a viable way to approach your health care. Mm-hmm. But it is most definitely a different approach than what we're trying to do, at least at the Okoboji Wellness Clinic. We are managing for some folks that come in with a direct primary care monthly membership with me as their primary care physician. I am helping manage that disease because that's the choice that they've chosen to make. They're like, well, I don't really want to make the lifestyle change. I don't really want to do these things, and so please go ahead and refill my blood pressure medicine.
Right.
And so that's the traditional system. But so many people, again, after COVID, are in the world of like, all right, I'm managing it this way, and my numbers might be looking pretty good. My blood pressure's looking pretty good. My cholesterol's looking pretty good, but I feel not good.
Mm-hmm.
I'm not thriving. I want to feel better. I want a better quality of life so I can get down and, squat and get onto the floor with my grandkids. I want to have those crisp minds so I can have the great conversations. I want to have so much energy so that I'm not wearing out in the evenings and needing to go to bed early. That's where folks are at, and they're like, oh, there's got to be more.
Mm-hmm.
And so that's what we're about. And we are here for the folks that, again, want to take that deeper dive as well, that want to look, how do I get, the body is a natural capacity to heal itself if we give it the tools to do it.
Mm-hmm.
And the tools, might be supplements, might be other modalities, red light therapy, frequency. That's a big part of what's coming in the future of medicine. Of course, voltage, oxygen through hyperbaric therapy is another big secret sauce that is incredible to help assist that body in the healing process. I always talk about folks are not malnourished in calories, but most of us are malnourished in vitamins and minerals. And if we are not getting what we need, how do we expect our bodies to thrive? How do we expect ourselves to have the energy, to have the mental clarity, to not have the inflammation and pain when our bodies are deficient in all these things? So let's give them the things that it's crying out for, it's missing.
Mm-hmm.
Let's figure out what those toxins are and assist the body in that healing process. And that's what we've done so well over the course of the last couple of years here. And the team is just fantastic. We take time. We listen to you. We set up your unique protocol that's going to be best for you. Take the pace that you want to take and trying to figure out, all right, it's so exciting. Just the wins from week after week. I had a gentleman yesterday that was talking to me about, every time I go off of omega-3s, I get skies.
Huh.
So that's his body telling him something that he's not getting enough omega-3. Why? And so then that's having an effect on his body. So there's a prime example. He's deficient in something. Let's fill that up. Let's fix what's going on. Why isn't he absorbing the omega-3 and essential fatty acids? Well, we're going to look into that. But in the meantime, let's give him some omega-3 and let's get him feeling better. So it's great. It's a blessing. It's an honor to walk alongside folks in the process because we are a bridge. Folks are starting they're starting to say, I want more. I'm not going to accept the way I feel like I'm just spinning my wheels. They're like, let's come to Okoboji Wellness Clinic, talk to the team here, and let's get some answers and let's get feeling better.
Well, I think this patient you talked about today is a perfect example. I'm sure he needed the prednisone to get through the day. And now he's decided that, he would like something more than that. And so trying to move from prednisone to getting his body healed. And so instead of a lifetime of trying to manage it with prednisone, he's opting to try and find a different way to get him to that cure stage.
Absolutely.
Yeah.
And so we're here for those folks that want to take that path and just so gratifying to see those folks have success with it, Dave.
All right, how do they find you so they can get on their journey to feeling not just surviving the day, but feeling great?
Yeah, give us a call at 712-339-6024. Carissa's in today, and so she'll be happy to take your phone call and get you any questions you have answered. Again, we're 3305 Berkwist Avenue in Spirit Lake, just off Highway 71, and we are Wednesday afternoons. I do the discovery calls, so that's kind of an interesting way to go about learning more about how do I exactly plug into this? How do I get going on hyperbaric therapy? How do I get going on functional nutrition to meet Molly? If I'm wanting to take this more of a functional root cause, whole body healing approach, what does that look like? Give us a call and we get you set up for a discovery 15-minute visit with me during the week, and we can talk about an initial game plan, what that might look like before you come into the clinic.
Very good. Dr. Meyer, always a pleasure. We'll visit with you next Wednesday.
Yeah, thanks, Dave.
Thank you, Doctor. Dr. Bradley Meyer of the Okoboji Wellness Clinic. Also find out more at okobojiwellnessclinic.com.